first receptor. We were speaking about the alpha-1 receptor, and we mentioned that alpha-1 receptors have a unique second messenger and a unique sequence of events to bring about their cellular response. So we talked about the G protein coupled to this receptor. It's a stimulatory protein. So the subscript S here means that when a neurotransmitter binds to this receptor, this is going to stimulate a response. We're going to see some other G proteins that are inhibitory. Upon that, the alpha subunit is going to dissociate off. It's going to head downstream in this membrane, and it's going to activate an amplifier enzyme. So the amplifier enzyme in this instance is called phospholipase C. And now phospholipase C is going to catalyze the reaction of cleaving PIP2, and I talked about PIP2 last time. This is phosphatidylinositol bisphosphate. You probably won't see that name written anywhere. You'll likely see PIP2 on an exam question or anywhere else for that matter. And so PIP2 is cleaved into IP3, which is inositol triphosphate, and DAG, which is diacylglycerol, okay? And so IP3 and DAG are the second messengers that are going to amplify the response of this neurotransmitter binding here. They're going to go into the cell and they're going to do two different things. DAG is going to catalyze protein kinase C, turn it on, and that is going to phosphorylate some protein and bring about a response that way. IP3 is going to trigger the release of calcium from its storage area in the ER, and that will bring about another means of a cellular response, okay? And so this is what happens when norepinephrine binds to an alpha-1 receptor. And this is the only receptor that uses this sequence of events, the only receptor that uses IP3 and DAG. Okay, now we're going to look at what happens to alpha-2 receptors and all beta receptors, so beta-1, beta-2, and beta-3. And this schematic is often a little bit confusing at first because it's showing all receptors in this one membrane, but this is just a schematic. So I want you to interpret this as being just showing the events that take place, but these receptors are really on different tissues, and we saw that, right? We know that beta-1 is on the heart, beta-2 is on the lungs, we know beta-3 is on adipose. So although we're seeing them here on one membrane, understand that this is just showing a collective view of the response, but these are on different tissues, and they're going to bring about different responses on those tissues. So we'll start by looking at alpha-2 and what alpha-2 does. So alpha-2 is going to be coupled to an inhibitory G protein. So the subscript I means that when a neurotransmitter binds to alpha-2, this is going to inhibit the following events, okay? The alpha subunit dissociating off, that subunit is going to block, hence this negative sign. It's going to block or turn off adenylyl cyclase. So we have another amplifier enzyme here. This is called adenylyl cyclase. And in the instance of blocking or inhibiting this enzyme, adenylyl cyclase, we are going to decrease the amount, okay, this is becoming a little confusing. We are going to decrease the amount of cyclic AMP, which is going to turn off or inhibit protein kinase, and that will bring about the cellular response, okay? So we're gonna completely ignore this side of the image as we look at just alpha-2. So alpha-2 binds to this G protein, this inhibits adenylyl cyclase, and we inhibit the production of cyclic AMP, and so that is how we bring about a cellular response. Now, to kind of describe this a little bit better, when we activate alpha-2 receptors, we're pretty much allowing the tissue to do what it would normally do. So we are blocking any external influence on that smooth muscle, and it's simply going to contract on itself. Smooth muscle has this tone or this ability to contract even if we inhibit its function. And so that's the kind of response that we see when we block these events on alpha-2 receptors, which is usually found on vascular smooth muscle. All right, so let's jump back here and discuss what happens on beta receptors. So when norepinephrine or epinephrine binds to a beta receptor, now this is describing what happens to any beta receptor. This can be beta 1, beta 2, or beta 3. The response is going to be the same in terms of the second messenger, in terms of the sequence of cellular events. So norepinephrine binds to this beta receptor. This is also coupled to a G protein, but this is also a G stimulatory protein. So it's going to activate by the subunit dissociating off that will activate adenylate cyclase. And adenylate cyclase catalyzes the reaction that produces cyclic AMP. So cyclic AMP is our second messenger that's being created here. And cyclic AMP will enter the cell. It's going to turn on protein kinase, and protein kinase is going to phosphorylate some protein within the cell, and that is going to generate our cellular response. So it's really important for us to differentiate that although these two receptors are using different G stimulatory or inhibitory proteins, they're going to be facilitating the same second messenger. So both of them are using cyclic AMP as the second messenger. Because alpha-2 is coupled to a G inhibitory protein, it's going to block this sequence of events, whereas all three of our beta receptors are coupled to a G stimulatory protein that is going to potentiate or augment or facilitate the sequence of events, okay? All right. And we'll talk about how this differs on different tissues. So once again, they're being shown here in the same cellular membrane, but remember, beta 1 is on different tissues, beta 2 is on different tissues, beta 3 is on different tissues. So the cellular responses are going to look very different depending on whether this is a beta 1, beta 2, or beta 3 receptor. Okay? All right, any questions? I'll pause here to see if there are any questions that pop up in the chat. And then we'll keep going. So any questions on this? Okay. And so this next slide is showing a table. So this is a very good studies tool. And I asked you guys to create a table that kind of synthesizes all the information that we talked about with regard to these cellular receptors. So it's going to show the effect on the organ, or the effector organ that the receptor is located on, the varying affinities for the receptor, so whether it prefers epinephrine or norepinephrine, or whether it has an equal affinity for both. This is also showing the effect on the second messenger, so whether it activates or inhibits its second messenger. And then it's also showing the effect on the effector organ, so the tissue that it's located on in itself. And what I really want to stress by looking at this table is that the effect on the second messenger is not the same as the effect on the effector tissue or the effector organ. And so what we can see is that alpha-1 found on most of our vascular smooth muscle, so the smooth muscle that lines our blood vessels, it has a greater affinity for norepinephrine. It activates its second messenger. So it's going to produce more of its second messenger, but that is going to be an excitatory response on the tissues. And we can compare that to beta 2. Beta 2 is found on most of our blood vessels. It's also found in the lungs. It has a higher affinity for epinephrine than norepinephrine. It's going to also activate its second messenger, which is cyclic AMP in this instance. But although it's activating its second messenger, this is bringing about an inhibitory response on the tissues. So don't confuse the effect on the second messenger with the effect on the tissues, okay? And we know that alpha-2 for beta-2, for example, is found in the lungs. And because beta-2 is activating cyclic AMP, that actually brings about relaxation of the bronchial smooth muscle. And that becomes an inhibitory response. And that actually aligns with a sympathetic response. So think about running, fighting, or flighting, or fleeing. you want to bring more air, more oxygen into the lungs. And so you're going to inhibit the bronchial smooth muscle, which will cause relaxation of the bronchioles. That'll open up the airways and that'll actually bring more oxygen in. So this is what I mean by a very different response seen depending on where this receptor is found. And so don't confuse its effect on its second messenger with its effect on the tissue, okay? Because those can be doing two different things. All right, and here's another nice table that summarizes some of the effects of certain drugs on the autonomic nervous system. And these are a lot of common drugs that treat common everyday problems or symptoms. And these drugs or medications capitalize on the autonomic nervous system. So a really good example is propranolol. So propranolol is a beta-1, beta-2 antagonist, meaning that it blocks or inhibits beta-1 and beta-2 receptors. And so we would use a drug like propranolol if someone had a really fast heart rate or a ventricular arrhythmia. So arrhythmias are where we have an uncontrollable rate or rhythm of the heart. And to counteract that, we want to block beta-1 receptors. Remember, beta-1 receptors are facilitating a sympathetic response, which is going to speed up the heart rate. So if we block such a receptor, we essentially slow down the sympathetic innervation, slow down the sympathetic influence, and we can treat this arrhythmia by blocking the beta-2 receptor. Another good example is isoproterenol. So isoproterenol is doing the opposite thing. It's an agonist. So it's not blocking, but it's potentiating the effect of this beta receptor. And so we use isoproterenol and other beta agonists for asthmatic patients, for example. And if you remember that scenario that I talked about earlier, with beta-2 receptors dilating or inhibiting the tissues to really open up the airways and bring more air in, when we agonize or mimic the beta receptor, we open up the airway and we bring more oxygen in. And that is the ideal type of response that we would want in an asthmatic patient, to open up the airways and to help them get some more oxygen in. And that's usually where they have trouble getting oxygen in. Okay. All right, so this is just a nice kind of clinical correlation table to show how we use the autonomic nervous system in treating some common everyday symptoms.